Good morning, everybody. And I want to take a moment to recognize the resident that we lost over the weekend, and my condolences to the family and my prayers. We lost a man in his 70s with multiple underlying health conditions, and that brings our total up to 134. And to all the 134 families that lost a loved one during these difficult times, our prayers and thoughts go out to you and your family. It's been a difficult time. It's been a difficult time for everybody, and it's harder to lose someone to this. And I know it's hard for these families when you keep hearing everyone out there on social media or just out on the streets saying this isn't real, this is made up, it's going to go away after the November election. It's here. It's real. It's a virus, and until we get a vaccine, we're going to be living like this. And unfortunately, CDC's saying maybe to the end of 2021. Hope it's not right. I hope we get the vaccine sooner than later, and we can stop the spread and try to get back to some type of normalcy going forward. But just to think about it this way, August 29th, which was just 2 weeks ago, that was the last death that we had. So, as we're seeing a spike in the numbers of positive cases, the other stuff works out. We're seeing a lower, the hospitalization rate went up and went down. There's the things that we watch as we go forward. But again, to the families, to the 134 families, sorry again for your loss, and our prayers. It's actually been 188 days for us in Albany County, and Thursday will start our 27th week. If you asked Liza and I 6 months ago, we'd probably tell you we wouldn't be still sitting here doing briefings and going forward. And we're trying not to do the daily briefs again when the numbers were spiking up over the last couple of days. We knew this was going to happen, and there's some things I'll talk about as we get going forward. But as of today, we have 2,714 positive cases of the coronavirus in Albany County. 507 people under mandatory quarantine. That's an increase of 12 positive cases overnight. We had 23 new positive cases yesterday. There were 4 days in a row where we had a new daily positives in their 20s. So, again, we were going in the right direction as the number was going up, but now we're going back. Since our last press conference, we've had 87 new positive cases. And just to hash on that on the last 4 days, September 13th, September 12th, we had 28. Out of that 28, 23 were college students. The 13th of September, out of the 24, 16 were college students. The 14th of September, 23 were out of the 23, 17 were college students. The 15th of September, we had 12, and 4 were college students. So out of the 87 new positive cases we've had over the last 4 days, 60 were college students. Now, I'm not pointing the fingers at the college students. We knew this was going to happen. These are things that we prepared for. So the things that the health department worked with the University of Albany, and my hat goes off to President Rodriguez and SUNY Chancellor Jim Malatras, because they're on top of this. We knew, again, you can plan for the best case scenario and you can plan for the worst case scenario, and we hope for the best. And the fact that, and I know Liza will probably have more to say this, having kids in college right now and living through this, not just as the health doctor, but as mom, I can only imagine the advice you're giving your children. We knew this was going to happen, but we need the kids that are fabrics in our community to do the right things, to roll up their sleeves and to work with us. Again, I've said this before. We want you to be here. We want you to try to enjoy somewhat of a normal college life experience. But you got to be smarter or more educated than your peers, and you got to be smarter than the generations before you that went through them hallways at these great universities or stayed on off-campus housing. You got to be smarter than them. And I know it's a little tough because for the freshmen, it's the first freedom you've had. Without your parents overlooking at you, telling you to be home at midnight or asking you where you're going. I get it. I truly get it. But we're in this together. So please continue to do the right thing to all the students out there. Of the new positive cases, we also know 7 had close contact to a positive case. 3 had reported out-of-state travel. 2 don't have a clear source of infection at this time. So to the EPI team, under Dr. Whalen. They continue to do a fantastic job through this whole thing. We have 10,644 people that have completed quarantine, 2,585 tested positive for the virus and have recovered, and that's an increase of 11. There are now 10 people hospitalized with a hospitalization rate of 0.36%. Of those who have tested positive, yesterday the rate was at 0.37, so again coming down just a little bit, but we're going down. Compare that to, like I said before, we had 15 people in the hospital just a week ago. We have 0 patients currently in the ICU. Yesterday's number was 1. Over the last 5 days, there's been an average of 22 new positive cases each day. Yesterday it was 22. We need everyone to wear their masks, socially distance, cough into your hand, continue to clean your hands, continue to stay 6 feet apart. Please, just by practicing these couple moves will help stop the spread. If you get tested, whether or not you have signs or symptoms, there are plenty of places to go, as we continue to point out. We still have the mobile testing site set up, but at the University of Albany, at the Uptown campus, you can call the number at 1-888-364-3065. I know there's some comments on Facebook. It's free. It's free. They shouldn't be charged. No one should have been charged if they did get charged, but I did see that, but it's free. Same thing with the mobile testing sites. If you have insurance, yes, they'll charge your insurance. If you don't, the county's slipping the bill. And Rite Aid and Walgreens are both free. So I haven't heard anything differently. So if there's an issue, let me know. For the mobile testing sites, you can call for an appointment at 518-465-4771. And then Rite Aid, go on site. It's at 155 in Central. Walgreens on Holland Avenue. You have to go to their website at walgreens.com/findcare/COVID-19/testing. And Priority 1 in Gilliland, the antibody testing, yes, they charge your insurance or whatever your co-payment is there. So just to make people aware of that, because I have got questions on that. So, as we look at the spike in positive cases with Albany, I thought it was important to bring the smartboard and look at some of the data we're seeing in Albany County. One of the things we've identified early on here was the 20 to 29-year-olds, and again, watching that number steadily go up, and more so than any other age bracket that we've been looking at and identifying. As September 13th, there were 567 total positive cases among people in their 20s. That's an increase of 36 positive since August 31st. Compare that to the 50 to 59-year-old age group at the same time period. You saw only an increase of 7 out of the 398. So again, I'm not trying to pick on the kids that are from 15 to 38. But that's the age group that's out there, and thank God you don't have underlying health issues, and thank God your friends don't. But you're the ones that are getting it and continue to not do the right thing by wearing your mask and socially distancing, staying 6 feet apart, and spreading it. And unfortunately, you're spreading it to people that can get sick, end up in the hospital, or worst case scenario, end up passing away. And so please continue to do the right thing. I just want to go to the smartboard quick, and then let Liza take it over. But and she'll talk about that, the trends and the graphs. And we have had comments and people talk about, well, you're showing where the number's at. Well, yes, this is where we started the 13th of March, and it goes up. And yes, some of our positive cases have gone down to low levels than before, but this is how it's affected us. It has been affecting us going forward, so we need to continue to look at that. I know people always have questions, why don't you go to the different direction? But it's on our chart. You can go through our website. It's right there. And again, 570 total cases. And, the 10 to 19 continues to go up slightly to 207. And you got to remember, that's an age group of people that normally aren't getting tested. So they're not out and about saying, hey, I better go get tested, or parents are saying getting their tested. But you should. You should get your kids tested, especially, school started. You're going to see issues that we've not only are having at Albany, but we're going to have with the school districts. And I commend the superintendent and Colony working with them and working with our health department. They identified it, and that's what we have to do. This is going to be the new norm. But one of the things I do want to talk about, you will see our numbers go up and down. We talked about this when the president for UAlbany was here. I commend Chancellor Malachis. They put a dashboard up. The governor got right on this with all the school districts. The governor's put out good guidance on this, and their dashboard. So parents can go on there and see it. You're going to be able to see it via school districts. You're going to see how it's affecting you, you know, and you know, all the information's there. But it's going to change. Because I know people are like this nowadays. They want to know. They want to know in that second. They want to say, well, you said this. There's going to be some information that's going to be wrong. Because we have to identify the students in, I'll let Liza talk about this because you're better at it. You know, basically, you know, they'll live here and then we find out they live somewhere else or we get numbers. So, you know, please bear with us. To the critics on you know, social media. You know, come do our job. Take a walk through the EPI department, take a walk through the health department, and trying to make this live information work and keeping people informed. But again, thank you to everything that you do. Liza.
Thank you. So I'm going to go to the smart board first, and I think it's a great point that you just made in terms of the first graph that we do get feedback on. I don't often look at the comments on Facebook when we stream, but I did see that somebody has commented that they think this is fear-mongering. Well, the way that this data goes is this is our total number of cases. This is never going to go in the opposite direction. It's not going to go down. It's a total number. We started March probably 10th when we were at 0, and we have increased over time to 2,714. That's not a number of active cases. That's the number of total cases that we've seen. So if you want a more accurate depiction of where our cases have been over time, this is the second number that we give. So to those who are looking to find out when did we have a lot of cases and where are our cases now, this is the graph that you want to look at. And as you see, it's a very busy graph, but it's pretty easy to look at. This is the total number of cases, and it goes up to, I believe, our highest day of cases. We had a report around 70 cases. That was back around the 20th of April. And going forward, you see where spikes in cases occur. And this is, you know, where we are right now in terms of experiencing higher numbers of cases, but this is over time. And often, because there are different reasons why we might get so many reports one day, so many reports another day, the best thing to do over this graph is draw kind of a line of best fit, which gives us an idea of where our cases have been over time. Right now, we're really paying attention to that data because we are starting to see higher numbers of cases. And is this the beginning of a trend? It's important to say one day is not a trend. We really need to look at data over 4 or 5 days. So when, for example, we get a spike of 24 or 25 cases, and the next day we get a report of 4 cases, does that mean we're on a downward trend? No. A trend can only really be determined if you look at data over about a 5-day period. So looking at the cases by zip code, we continue to see the highest number in this 12203. And as we've been bringing a lot of attention to, we do know that that's a neighborhood where a lot of SUNY housing is located. And this data, I think we've gone over. We continue to see slightly higher numbers in women and than men. We continue to see disproportionate numbers for COVID severity in our Black and or African American communities. So, we continue to test high numbers of people, and we are pleased to report that there are increasing avenues for people that want to be tested. We are starting to see increasing numbers of centers that are opening rapid tests where you can get a test that will give you a result in 15 minutes. And we also continue to see high numbers tested at the SUNY site in downtown or up at the campus site. So if we look at a daily trend for Albany with the state numbers on the 13th, I'm sorry, which is the last day they have their data up, there were 555 persons tested in Albany County and 6 were positive. So we're following that data along. And I wanted to talk a little bit today about schools. And when we talk about schools, we're talking about two kind of distinct communities, the K through 12 schools and the universities. So we have been very busy within the last week having numerous conversations with the students, parents, and particularly the administration of the K through 12 schools. And I want to take a moment to just congratulate all the superintendents that have just really worked hard on their back-to-school plans. I have just seen a tremendous commitment to following guidelines, to making sure that they are operating with the best interests of the students and families that they serve. It is not easy. And there are a lot of questions that we're getting, and we're working with them. We know this is a real-time evolution of adopting protocols and programs that the schools have never used before. So with that, there are going to be a lot of questions. There are going to be a lot of things that we have planned to work out, and we have those plans, and there's going to be things that we need to work out as we go forward. So we appreciate that partnership and going back and forth with the school districts, and continue our commitment to having this daily dialogue and working closely with them. In terms of the universities, we got some questions this morning because of the concern around what is the number that would need to be closed down, and how do you look at that data? The data and the recommendation really calls for there to be 100 students that are living on campus. And as we are looking at the situation at SUNY Albany, we are finding that we are seeing the majority of cases in students that live off campus. And by off campus, that doesn't mean students live off campus and they attend classes. We have established the way that we at the health department look at this as off campus means you not only live off campus, but you do not go to campus. So these are students that in our data we are looking at as being entirely remote learners that are not on campus for any reason. So it is the on-campus, or those that are learning on campus, those that are attending on campus, that number is the number that we are carefully watching and having continued daily conversations with SUNY. Another question that I got is, about how do you look at this data over time, because the guidance talks about 100 cases on campus during a 2-week time frame. And, from our perspective, we look at this as a rolling 2 weeks. So has there been a 2-week period where we could identify that? I know others have been reported out as looking at that differently and looking at it just from discrete time periods. Again, this is new, so we'll be reaching back to the state and other partners for their specific guidance on this, but from an epidemiologic point of view and from a logic point of view, it really makes sense to look at this in a rolling time. Was there ever a period where we were concerned we were hitting that number? And of course, more important than the number is how do we work with the school on identifying communities within the school, because it's a big university. There are lots of different places where students congregate and lots of different settings that could represent increased risks of transmission. So how do we do that? That's really drilling down on the data, looking at the cases individual. And we at the health department get that information. We don't share any HIPAA-related information with the public, and we don't necessarily share names other than the names that have been identified by the university to us with the university. We try to look at it in terms of, are there clubs? Are there specific locations? Are there specific classes? And if so, how can we modify the risk there? So there really is a tremendous amount of work that goes into this, not only in the data, but also in how we analyze the data, how we look for trends, and how we use that to reach back to the university. And this not only occurs with SUNY, it occurs with every single case that's reported to us. How do we reach back and ensure that those that may have been in contact, that may have been placed at risk, are advised appropriately, are quarantining at home for their isolation period? And this really is how we control the spread of COVID through the work we do at the health department. It's basic public health, and it's very time intensive. And we are dealing with an outbreak, the time and scale of which is quite honestly unprecedented, and I don't think anybody would be surprised to hear that information. When we look at how we, I think another point that I would bring up to echo what the county executive said is to talk about the data, how we get data in, and how that data comes to us. So for example, if we had a case reported to us of a SUNY student this morning, patient, we'll call it Miss X. So Miss X is reported to us. She has been identified as having a positive test for COVID. She resides in a residence that is off campus. We contact her, we do a case investigation, we get her address, we get the appropriate contacts. She lets us know that she has been in contact with her family, and she is going to move back for the period of her illness, and she's got all that taken care of, to another county, to Saratoga County, we'll say. So we call Saratoga County, we tell them this person is coming to you. Saratoga County then would take the responsibility of the case, contact the family, make sure that they're aware of how the case needs to be managed at home, and follow the case on a daily basis. So that case came to us, was counted to us, but then moved home. So that's one scenario where you may see a number look like there was a case yesterday that wasn't there today. There are other scenarios where we get a case reported to us that has an address that may be wrong. Well, I do attend SUNY, but I in fact live in Rensselaer County. So that may be reported out to Rensselaer County. We similarly, Rensselaer County may get a case and they say, no, this is an Albany County case. So there's all this movement is going back and forth. The cases are all followed. They're all within a central database that all of us at that local health department have access to. But this gives you an example of how difficult it is to report at the moment accurate data, because it is subject to change. And this can be responsible for the data fluctuations that you see between our data, the state health department data, and any of the dashboards that the universities are setting up. The university data dashboards may contain information for the students that they are aware of that tested, but if a student is living off campus or is attending virtually from another county at home and goes and gets testing independently with their private practitioner, unless they report that back to the SUNY health system, they may not be counted on the dashboard. So these are all things that we're working out on a daily level at the health department to try to ensure that we can represent to the public the best data possible. The data that we have is the data that we have, and that's what we report out and work every day to make this more accurate and informative to the public. But it is important in terms of how we talk about general trends to be able to inform where we are, because with a real-time situation, that is often where we get our best information from, is the trends and what's happening. So I appreciate everyone's patience with that, and please know that the numbers that we share with you every day are the result of positive tests that are entered into an electronic database that we get. And then, as I said, that's throughout the state.
Thank you. Thank you for explaining that. And I know it's a lot to take in, but in real time, sometimes it's hard to get up-to-date data, and as Liza just explained, so thank you for that. Just trying to highlight some other things that are going on in the county right now. 188 days into this, 6 months. Our departments didn't shut down. We have essential services. We're obligated to run for the state and for the federal government. We had to do things differently, just like the media had to reinvent the way they work or print the paper or do different stories or get things out there. So one of the departments I do want to say, give them a huge shout out to, was the probation department. This week hosted the 5-hour DMV pre-licensing course for people that are on probation. And it's a program that we started first in the state of New York, I think 2 years ago. And it's an awesome program. And people say, well, why? 20% of kids on probation, unfortunately, don't have a driver's license. And if they want to get a good job and they need identification, then what better way of doing it than help them get their driver's license and get that foundation built under their feet? So they go off of probation earlier, saves us money, and they don't reoffend, saves us money. But to probation, thank you for everything that you're doing to continue to do this. And the course is offered to anyone that's on probation. But again, it's another department that did not shut down through this whole thing, had to reimagine what it was going to do, how the mission was going to get done, as well as every other department out there throughout the county. So again, thank you to all the essential workers for doing your job and keeping us moving forward, to everyone that was out there doing that. I just want to remind people mental health is always available 7 days a week from 8 a.m. to 5 p.m. The number you can call is 518-269-6634. And our 24-hour sexual assault hotline number, 518-447-7716. And as always, our 211 in the New York State hotline. Just remember, it's a marathon, not a sprint. We're in this together, and we'll get through it. And to everyone that is doing the right thing and wearing their mask properly and doing the social distancing, cough into your arm and clean your hands, thank you. And again, we'll get through this because we are resilient here in Albany County. And thank you to everyone.